topic given me is the Universal Health Care Law. In the program, it says implication to maternal and child nursing. However, I decided to expand it to nursing profession because the law is more encompassing. And there are other areas that, in fact, nurses can go into because of this law. So I have several slides that will show you what nurses can access or can contribute to because of this law. Okay. This is a very recent law. It has been signed only in February 2019. So in fact, the IRR, or the implementing rules and regulations, are not there yet. And that's why I am using my own interpretation of the law, because there's no IRR as yet. Even my good friend Yusek Tong-an has said that they are actually in a hurry to come up with the IRR because they're only given 180 days from the signing of the law, which means sometime in August, the IRR should be around or should be available. Okay. Let me begin by saying what's the policy of this law. So the declaration of policy, it says, it is the policy of the state to protect and promote the right to health of all Filipinos and instill consciousness among them. Actually, this law is the enabling law of our 1987 Constitution. Because if you look at our 1987 Constitution, Article 2, Section 13, it says that health is a right of the Filipino, okay? Every Filipino. So, the Constitution is our fundamental law. However, you need enabling laws to make this really work. And I think the Universal Health Law is, in fact, what we need to make that law or that fundamental law implemented as we view it as for all Filipinos. Okay. To achieve the policy, according to this law, the state shall adopt. There are several, but I only picked out those that I think would be of value to us. A healthcare model that provides all Filipinos access to a comprehensive set of quality and cost-effective. I think the key words here should be quality and cost-effective. And it covers promotive, preventive, curative, rehabilitative, and palliative health services without, and this is the critical part here, without causing financial hardship, and prioritizes the needs of the population who cannot afford such services. If you're familiar with our PhilHealth law, the law covers inpatient, not covering promotive, preventive. This law expands that. In some Q&A articles that you might find before the bill became a law, they were saying PhilHealth would be changed into something else, or the name would be changed. However, in this law, it retains the name PhilHealth, okay? And it just expanded to cover promotive, preventive. And if you recall, or not recall, but we all know that in nursing, this is our key area, right? Promotive, preventive. And when I was president of PNA, I asked actually PhilHealth, and I was saying, why are you not covering a health education which will ensure that the patients will not be going back and forth into the hospital after they are sent home? Because they're given health education. Why are you not covering that? When I say covering, I mean compensating health education as a function of a nurse. And I was told, well, we're sorry, but the PhilHealth law covers only inpatient. And this one will definitely revise that. It will now include promotive and preventive, which really is the area of nursing. While we say the cure, it's an interdependent function, but preventive and promotive we can very well do it as an independent practitioner. To achieve the policy, the state shall adopt a framework that fosters whole of system, whole of government, and whole of society approach in the development, implementation, monitoring, and evaluation of health policies, programs, and plans. When they say whole of system, remember the DOH health services is devolved. And many times the policies and programs of the national do not trickle very well down the LGUs. But with this, the LGU is mandated to really carry on national health programs as well. In the past, well, when I say in the past, I'm talking about the devolution of health services. If the mayor doesn't like to carry on a program, no matter how good the program is, it's not his priority, it's shelved, okay? And sometimes the health worker who did not support that mayor will become floating. Like I know of one municipal health officer who became the sanitary something in charge of garbage disposal and all that because he did not support the mayor in his bid. Remember, our local governance is we elect every 3 years. So that's why those who are in the LGUs have to play ball with their local government officials, because every 3 years, if you don't play with them well, you probably will get a floating assignment. Okay? So with this whole system, whole of government, and whole of society approach, so it includes the community. They're really being held, encouraged to participate. Now, what's the service coverage? Every Filipino shall be automatically included into the National Health Insurance Program. In the current, you might call, in the current PhilHealth, there is this yellow card for the ones in the barangay. But it does not cover all services. And again, it is very political. They give it to those who they like to give it to, and it's not everyone that gets it. But this one, everyone will really be included. Every Filipino shall be granted immediate eligibility and access to preventive, promotive, curative, rehabilitative, and palliative care for medical, dental, mental. Again, in the current PhilHealth, mental cases not covered. It's not covered. Now it is, okay? Because I think it is realizing that this is a problem that needs to be addressed. In the current, or let's call it the current, kasi wala pang IRR and it's not yet implemented. It will be implemented hopefully by August. It does not cover if you get confined for mental illness. It does not cover, as I said earlier, preventive, promotive activities, like mga check-up. It's not covered because it's not part of, even if you are an inpatient, but if it is for check-up, it's not covered. That's why some doctors, if you have a friend doctor and you want a medical check-up, you ask him to put a diagnosis. Pakisabihin dyan, headache, prolonged something, so that there's a diagnosis. Then there is a need for all those tests that you want done, which actually is just a medical checkup, your annual medical checkup, right? Okay. And emergency health services delivered whether population-based or individual-based. Population-based health services refer to interventions such as health promotion, disease surveillance, and vector control, where the population group is the recipient or are the recipients. Population groups are the recipients. For the individual-based health services, this refers to services which can be accessed within a health facility or remotely that can be definitively traced back to one recipient. I think the idea of telemedicine is already coming in with the word or remotely that can be definitively traced back to one patient. I know that PGH or UP Manila has a telemedicine facility. Yung telemed is already servicing remote doctors, physicians, and they help in the diagnosis through telemedicine. So I think, yeah, telehealth. The word or remotely allows that to be interpreted as such. That's why I was saying, sayang wala pang IRR, but if the IRR would be in the discussion, I'm sure that will come out. How does one become a member? Remember, we're all automatically going to become members. Now, most of us who are here, because we are working, are direct contributors. They will pay premium rates following a schedule and monthly income. There's a matrix of this. I did not anymore talk about it because I'm not sure. I don't know how this will be implemented in the IRR, but definitely it will mean additional contribution. According to, there's a scale. My floor, 10,000, and ceiling ay 50,000, and it says 2.5% in 2019. Parang ganon ang magiging contribution. Now, for the indirect contributors, the premium subsidy shall be included annually in the GAA and released to PhilHealth. So these are the ones who will be getting the PhilHealth card to allow them to benefit, to avail of the services rather. Now, this is where I think you might be interested, or we all will be interested in. It's Chapter 6 on Human Resources for Health. In Section 23, the DOH, together with the stakeholders, shall ensure the formulation and implementation of National Health Human Resource Master Plan that will provide policies and strategies for the appropriate generation, recruitment, retraining, regulation, retention, and reassessment of the health workforce based on population needs. To ensure continuity in the provision of the health programs and services, all health professionals and healthcare workers shall be guaranteed, ang ganda ng word, guaranteed employment and competitive salary, which I am interpreting as no more nurse deployment. Kasi right now, the nurse deployment program is a one-year program, and although it can be renewed, but it's a yearly, annual. You have to, I think, apply, then be renewed. Annual lang siya. It's not a plantilla position. We're hoping, again, with this provision, that it will be a permanent employment. Meaning with plantilla. Kasi you cannot be in permanent employment without a plantilla. You will wonder, where will we get all the money? Later, I'll show you, there's a sources of funds. Okay? And, ang ganda ng adjective, competitive salary. Magkano kaya yung competitive? Yung minimum wage law, excuse me. Anyway, sabi nga in the May 1 rally, they were saying the 532 is not enough. It has to be at least 700 plus. For minimum wage lang po yun. So what's a competitive salary? Where are you competing with? With abroad? Obviously, out of the question. Competing with what? With local? Hopefully, it will materialize. I'm not a pessimist. I'm just a realist. I just know that it takes time for all these things to move. Now, the PRC and DOH, in coordination with the duly registered medical and allied health professional societies, shall set up a registry of medical and allied health professionals, indicating, among others, their current number of practitioners and location of practice. Actually, at PNA, we've been discussing this. We need concrete data, accurate data of how many are really active practitioners and how many and where they are. We don't, I was a member of a task force that tried to come up with, ang title namin yata ng work ay health workforce, something for nursing. And we could not get from any government agency an accurate set of data. If you go to PRC, they will give you 800,000 something. But that means from the time nurses got registered to the present. You don't know how many are dead, how many are no longer practicing. So our chair then was Dr. Lynn Lorenzo, and we had to have a surrogate indicator, I think was the term, that we will put in us when the nurse will practice from age 21 and retire at 65. So how many years would that be? Subtract that from the year that she got registered to the year she has retired, and that will be your active professional nurses. Guesstimate po yun. You cannot get an accurate one. Even at the time of Dr. Meng Abakin, as the chair of PRC Nursing, they would have very different data from DOLE, from DOH, from mahirap po. And this is why I'm hoping that PNA will come up with data, madam. Kasi ka-PNA ko itong si Ma'am Rita When we discussed this at the, ano tawag sa atin? DevCom. DevCom. We need to really come up with accurate data. Kasi we are the accredited, sabi niya, duly registered. We're the accredited. And yet when we get asked, how many are you? Our active members is 60,000. Active lang yun. What about the rest who are not members? Are they not active? I mean, in terms of practice, we don't have data. Actually po. And that should be one of our projects. Wala si Dean Sheila. She's the chair of research. Ito pa, the chair, PRC, and DOH, in coordination with the registered medical and allied health professionals, shall reorient. Parang as if we just had a new curriculum and it's in second year, pero reorient medical and allied medical professional education and health professional certification and regulation towards producing health workers with competencies in the provision of primary health care. And I think this is where maternal and child nursing really come in. Because one of the, you might say, a key program of primary health care is maternal and child. We know that, and it's been there all this time. But we also know that the MDG in 2015, we were not able to achieve the target for the maternal. We were able to achieve the target for the pediatric. But if you go down into, by age group, the neonatal is still not achieved as target. Why? My hypothesis is that because the neonatal is attached to the mother. So if the maternal morbidity and mortality rate was not achieved, you can expect that the neonatal target would not also be achieved. Why? Because these two are inseparable. When they are in the perinatal stage, the health of the mother affects the baby, and when you deliver that baby, it will take a lot of work to make that baby really become healthy if the mother was not healthy at that when she was pregnant. So maternal and child nursing is really the key program in primary health care. So I was asking, how many are MCN major among the students here, the graduate students here? I only heard two. Dalawa na kayo. Okay. Because in graduate program at UP, whether it's the College of Nursing or OpenU, we train you to become clinical specialist. And hopefully, you will focus on this area. And there's, I'm sure, big room for you to come into the Department of Health. Kaya lang, I think these two ladies are from abroad. Tama ba? You're not. That's good. Because many of my students in MCN are from Saudi Arabia, from Singapore, so they're going to improve the health services of Singapore and Saudi Arabia. We are international, so okay na lang. Alright. Return service. Ayan. I was telling Dean Peng earlier, 2 days ago, that all graduates of allied and health-related courses who are recipients of government-funded scholarship program shall be required to serve in priority areas in the public sector, hindi private, for at least 3 years, with compensation and under the supervision of DOH. I know that here in UP Manila, you have a return service agreement. 2 years ba? Ito 3 ha? 2 years ba ang return service agreement? Nasaan yung mga nursing student dito? 2 years ba? But this one is asking for or saying 3 years. So I don't know how they will reconcile this with what already is ongoing here at UP. All right. Hospitals are mandated. All government hospitals are required to operate not less than 90% of their bed capacity as basic or ward accommodation. So if you have private rooms or private services, this should be only about 10%. 90% should be basic or ward accommodation. Then specialty hospitals are required to operate not less than 70% of their bed capacity as basic or ward. For example, heart center. I know they have a lot of private rooms there. So maybe they have to restudy their allocation. Even private hospitals are required to operate not less than 10% of their bed capacity as basic or ward accommodation. Why is it keep saying basic or ward? Because this is where they are given the free services, no balance billing. So if you're government, you should really have so many bed capacity or so many beds available for that particular package. Specialty, ganun din. Private, nandun na, they're not subsidized by government, so they're required, still required, but at least only for 10%. Now, health promotion through health education. We say in nursing, one of our independent nursing function is to give health education. And this is being given emphasis in this law. Health promotion shall serve as the basis for DOH in increasing health literacy with focus on reducing non-communicable diseases. Actually, in the Philippines, we now have what we call the double burden of disease. In the past, our main burden was communicable diseases. Now, we have both. The non-communicable and the communicable is still there. And the communicable is still there. Non-communicable is already rising. Nandun na siya sa top 10 causes of morbidity and mortality. And implement health promotion programs and activities across social determinants of health. I think the idea of social determinants of health, while it has been there as a concept of public health, it's not been given enough attention. But in the more recent past, like maybe 5 years, 10 years past, we have realized that no matter how good your health program is, if you do not consider the social determinants, you probably will not have an effective program. Example, MCN. Family planning has been in the Philippines since the 70s. I know that because when I was still teaching and following students in the community health nursing, That's one of our main function. Well, function, yeah. To teach about family planning. Why is it that we could not bring down, although now medyo bumaba ng fertility rate natin, we used to be 3.7, now I think we are down to something like 2.8 fertility rate. Bumaba na rin, but it took so long, from 70s to what, 2010, 2019, so ilang years na yun. Why is it that it was not that successful? Because the social determinant of health, such as what? Religious belief, culture, family orientation. If you bring down, I talk about this when I discuss with the students, I say, in the province, when you talk about have less children, especially among farmers, or those who do the work in the rural areas, they do not believe in having fewer children. Firstly, because the mortality rate is high. So if they only have 2 or 3 children, and they die because of measles or of dengue, wala na natira. So they want maybe 6. And if they are tilling the land, farming, they would hire extra help to do the pag yung harvesting season. Kung mayroon kang 6 children, they can help you with harvesting. So it all is the income of the family and not being paid out to other workers. If you talk to women in the rural areas, many of them still think that the primary function of the woman is reproduction. Although now it's gradually changing because we're focusing on productive function of women and not just reproductive function. Productive function. And we know that the sky is held 50% on its place by women. More than 50% pa nga tayo sa Philippines eh. I think we're like 52% of the population. So we are more than 50% is holding the sky high in the Philippines. 48 lang yung men. Anyways, so the social determinants of health now are being given big emphasis even when you do health education. You really have to. Gaya ng wash your hands when every time you get out of the comfort room in the public school. Unang-una, may tubig po ba? Pangalawa, malinis po ba yung comfort room? Pangatlo, anong klaseng tubig ang lumalabas? Yung medyo murky na brownish, pangugas ng kamay, excuse me. Tapos ala pang sabon. So parang, if you just focus on wash your hands, sige, they will wash their hands. But will it achieve the objective? Kaya parasitism is very high in our school children, public school children. Ang solusyon, deworming every 6 months ba yung deworming nila. But it does not get to the root cause. You have deworming every 6 months. Sige, that's probably good. But if you don't get the other support services that should come to preventing parasitism, wala yan. Okay? So the social determinants of health needs to be addressed. Now, in MCN, we consider school nursing as one of our areas. What is the opportunity for you, those who are in school nursing? DepEd, in coordination with DOH, shall formulate programs and modules on health literacy and rights to be integrated into the existing school curricula to intensify the fight against the spread of communicable diseases through, among others, the effective promotion of healthy lifestyle, physical activity, proper nutrition, and prevention of smoking and alcohol consumption among students. There's a study about smoking that the target now of tobacco companies are are getting younger. Yung mga bata sa school na, hindi na yung adults, because the adults perhaps have realized and have read all those mga pictograph natin na nakakatakot, nakasama sa ano, but the kids probably will find it difficult. However, it's only in the Philippines, well, maybe I'm making a sweeping statement. In the Philippines, not only, in the Philippines, we can buy one stick of cigarette at a time. There was a bill that said, you cannot buy per stick, but you buy by packet. Packet ba tawag nun? Pack of cigarette. Because if you buy the pack, ando doon yung pictograph eh. Pero when you buy it, doon sa mga naglalako na sigarilyo isa-isa, you don't see the packet, the packaging. So, useless packaging for pictograph, ang mahal daw nun. Anyways. And then, because the whole pack is expensive, but they can buy one stick at a time, they do not feel the pain of the cost. Why? Because you can buy one. And then, after a while, you can buy another. So, nakakakonsumo ka siguro ng isang pack, pero padala ₱2. And that's, I think, one of the reasons why smoking is still rampant. And I'm thankful that our president has made this a national policy na no smoking, although ang daming mga magagaling na ways to, how do you say that? To circumvent the law. I know in one hospital, private hospital, the doctors and the nurses cannot smoke inside the hospital, right? They're all out there in the Pitan and in Lacson, smoking. Naka-uniform. How could you be able to convince others not to smoke when you yourself do not follow the rule? Anyways, naka-uniform pa. Skandaloso talaga yun. Okay. For nurse researchers and nurse managers, the DOH and the DOST shall develop a cadre of policy systems researchers, o yung mga graduate students and faculty, you might like to become policy systems researchers. So you will study the policies and come up with better ones. Technical experts and managers by providing training grants in globally benchmarked institutions, provided that the grantee shall be required to serve for 3 full years as return service. But at least this time, they're realizing that there's a need for capacity building. You cannot just be talking about do this, do that, when they're not competent. They don't have the competencies to do it. So you really have to provide it to them. Natural lang. Of course, if the government spends for you, it's just fair enough that you should also have a return service. And ito yon, mga graduate students, participatory action researches on cost-effective, high-impact interventions for health promotion and social mobilization shall form part of the National Health Research Agenda of the Philippines, of the Philippine National Health Research System. I did not anymore add here, but there's a sentence which says, and it shall be funded by the OST. So if you have any research that would like to evaluate cost effectiveness, do so. Or mobilization of the community. That's a good idea. I'm sure that will get a good priority funding from the OST. Now, where do we get the funds? Or where will UHC get its funds? Sin tax, we all know that. There is now an increase or incremental taxation, the alcohol and the cigarettes, alcohol and tobacco. So there is an incremental collection for taxes, okay? Then 50% of the national government share from the income of PAGCOR. 40% of the charity fund of PCSO. So PCSO will no longer be giving out yung bang pipila ka ng 1 kilometrong layo. Every morning, pupunta ka doon alas 4 ng umaga, and then matatawag ka mga alas 2 ng hapon, bibigyan ka ng sleep for 5,000. Ganun katagal ang haba. So mawawala na ata sila. That part. And it will be taken over by that PhilHealth card. Then premium contributions, tayo yon ng mga members. And for the indigent or the indirect members, the annual appropriation of the DOH, which is included in the General Appropriation Act, and the national government subsidy to PhilHealth included in the General Appropriation Act. Looks very tempting, very inviting. Sabi nga niyan, there's a saying that says the devil is in the details. And that's why IRR is very critical. So this is the law. The law is beautiful. I say beautiful kasi nakasulat, maganda. But the IRR is where the details are. And this can be where the devil will come in. The devil is in the details. So if you get invited to attend consultation meeting or be a task force member, do not say no. This is the time we can be heard. Ang isang nakita ko, one of the things I've noticed among us nurses is we complain when the law is there already. Take note, when the law is there, you can shout to high heavens, there's nothing you can do. The time to do something is when it is being deliberated upon. So while the IRR is being discussed, I don't know whether they tap OpenU, they tap PGH, they tap PNA, I'm not sure. But I hope if you have the competence, you can volunteer. Just as an observer. You tell them, may I be an observer in the meeting? You don't have to spend for me, I spend for myself. So that you can have an idea, what are they talking about? And perhaps it can spell the difference between success and unsuccess or non-success of this law. So I think I have made my point. Thank you.